And Mara, I'll start when you say. I think we have about 2 more minutes. But please, in the chat, everyone, introduce yourself, your name, the city you are from, and your organization. And as we are waiting to begin, you can also, if you have some questions, think about some questions to ask the panelists as well. And we're going to be prompt. Oh, Tinton Falls, New Jersey. New Jersey in the house. Red Bank. Okay. Amy, I see you. Newark, New Jersey in the house. So we are going to be prompt, everyone, because we know that so many of you have had a long day. So let me start off. My name is Kim Gaddy. I am the National and New Jersey Environmental Justice Director for Clean Water Action. Clean Water Action was founded in 1972. We were the organization that established the landmark Clean Water Act. And although water is in our name, it's a little misleading. Clean Water Action actually focuses on environmental justice, climate change and clean energy, toxic chemicals, waste, civic engagement, and elections. We have a 501c4, so we endorse candidates, and we also work on oil and gas campaigns. It is really important that the work that we do across 13 different states for Clean Water Action is we work very hard with a hard canvas field. I want to say thank you to our canvas team that's out there. They go out each and every night knocking on doors to help us with our membership. Nationally, we have 1 million members across the different states. And this is so important because it allows us to not take money from polluters and hold polluters accountable. We are a grassroots organization that works very hard to ensure democracy works for everyone. So we do thank you to our Canvas and our phone team for all the work that they have done. And now I want to just start off briefly and give you a little bit of information about World Asthma Day. You know, the history of World Asthma Day, it started by the World Health Organization back in 1993. Then in 1998, 35 other countries celebrated World Asthma Day. And this year's theme is Uncovering Asthma Misconceptions, which aims at clearing up the misconceptions that people have. For example, I'm a parent of 3 asthmatic children, and my oldest son is 32, and he would often say, "Oh, mommy, I grew out of my asthma." That's a misconception. You never grow out of asthma. What happens is you learn how to manage and control that asthma. And over the years, and as his lungs was able to grow and to heal, he was able to now control his asthma. And we had an asthma management plan. We went to the doctors. And so you have to work really hard at it. Another misconception is that asthma can only be controlled with steroids. That's another misconception. And we have Dr. Gentile that later on she's going to talk about some of these things, and she could actually speak to some additional information. And then lastly, one of the things that was crazy that I saw was that asthma is infectious. Like, I'm going to touch you and give you asthma. I don't know where that came from, but some folks think that, oh, let's stay away from individuals with asthma. No, that is not. That's a misconception. And so we want to make sure that as we inform you tonight on some of the most crucial aspects of asthma, we want to make sure that you are protected, right? you are protected from the triggers that impact asthma, but most importantly, you are educated because in 2021, we should not be having family members dying of asthma. Another experience, my brother in law died from asthma, came outside to get some fresh air, died on the porch. My cousin made it to the hospital in an ambulance and died in Bethesda Hospital. So it's a very serious chronic disease. And so it's very important that you understand what it is, you understand the triggers, and you understand how quickly it can take somebody's lives. You know, it is the number one reason that our children are absent from school, right? Because of asthma. And so, with that, I want to just jump into our exciting panel that we have here. We are going to start off with each panelist introducing themselves. I'm going to pose an additional question to each and every one of them. They're going to speak for 5 to 7 minutes. So I want you to listen to what they have to say. And remember, if you have any questions, put in the chat so we could also answer your questions. And then also it will be a dialogue after that, okay? So the first person I'm going to introduce is, of course, our Dr. Deborah Gentile. And she is going to come to us and speak for 5 to 7 minutes. And in that introduction, Dr. Gentile, what I would like you to answer is, what does asthma, why does asthma make me, and I live in Newark, New Jersey, more vulnerable if my home or job is in a community that's highly polluted upon? And then also, what extra precautions should individuals who live in these communities, and especially with COVID, what can they actually do? Dr. Gentile?
Sure. Thank you very much, Kim, and thank you for everyone for inviting me and for everyone for joining us. I actually am a pediatric allergy and immunology physician here in Pittsburgh, and over the last 10 years, I spent a lot of my time looking at the true prevalence of asthma in children who live near point sources of pollution, industrial sites that are spewing out pollution every day. What we found is the children actually have a 2 to 3 times higher rate of asthma than you would expect. And those that know they have asthma, they're much more likely, twice as likely to be poorly controlled as children who don't live near these point sources of pollution. So there's an association with the pollution as well as having asthma and having uncontrolled asthma. So why does asthma predispose you to have issues with pollution? We have a lot of evidence that shows the pollution actually contributes to the development of asthma. It can actually impact lung growth so that your lungs don't grow as well. They never attain their full adult size if you're exposed to triggers like air pollution. And we also know that the pollution can increase inflammation or swelling in your breathing tubes acutely and cause attacks. So it both contributes to having asthma, a high prevalence of asthma, as well as having poorly controlled disease.
Well, thank you. Thank you for that. I mean, it's really important because this helps us to kind of get a better understanding of what actually asthma is and how we can, protect ourselves. And just one clarification, because I read an article about COVID-19 and the rates with those individuals with asthma. Can you clarify that article? It stated that I thought it would be higher because of this status, but it actually wasn't.
Right. It's very interesting. At the start of the pandemic, we were very concerned that the asthmatics would have very severe illness with COVID and they would be much more susceptible to the infection. What's actually has happened is that many asthma attacks are triggered by respiratory viruses. And during COVID, we've all been social isolating, wearing masks, not interacting, and we really aren't seeing patients get respiratory infections. Flu cases are down, common colds are down, and those are very, very common triggers of, asthma attacks. So in a way, that's very good that we saw that. Part of your first question you had asked me is what can people do to protect themselves? And you had started by saying that the answer isn't always just steroids. One of the things we'd like to do is prevent this disease from forming. And we know a variety of factors can impact that. We know tobacco smoke can predispose to asthma. So that's why they actually recommend, moms not smoke during pregnancy, no one else in the home. And then if there's children in the home, not to smoke. The same thing is true with air pollution. There's data that shows that the air pollution, while the fetus is developing inside mom, can actually skew their immune system to be more likely to develop allergy and asthma. So you definitely want to be protecting yourself from air pollution as well as tobacco smoke.
Okay, thank you for that. Now, our next panelist is a very good friend of mine, Cindy Loopy, and she is the actual reason that I started to get involved in World Asthma Day. I was looking through the internet and I saw that her office of Clean Water Action was, involved in World Asthma Day. And I called her up and said, well, how can I get involved? And so that has now evolved into this national World Asthma Day where Clean Water Action has partnered with Athena and the Moving Forward Network to educate individuals about asthma. So Cindy, can you tell us how long you have been involved in World Asthma Day activities and the importance of this day? And then also, how can Clean Water Action have a local impact on health issues like asthma that has a disproportionate impact on Black, Brown, and low income communities?
Absolutely. Thank you, Kim. Thank you, everyone, for joining us. I know that a lot of us spend most of our day on Zooms these days, either for school or for work. And we really appreciate you being part of this national movement for asthma justice. So all our thanks for being here. And Kim is a true shiro. So it's a pleasure to get to work with her and really everyone on the panel tonight, a lot of rock stars here. So I got involved with World Asthma Day and the hashtag Let Us Breathe movement about 4 years ago. Clean Water Action is part of a really groundbreaking coalition in Massachusetts called the Green Justice Coalition. And by design, we work on issues that unite us around environmental justice, worker justice, and racial justice. The idea is to look for integrated solutions that address some of the root causes of all of these problems together. And that of course, meant that we were working a lot on climate justice. And what we found, I don't know what the rest of you experience in your communities, is that the climate crisis seems a little hard to visualize. It's hard to take it in. But people in the neighborhoods and grassroots leaders and justice leaders were really clear that asthma is a marker in their eyes for excessive pollution and a whole lot of other problems that combine to make asthma capitals into many low-income and Black and Brown communities. In Massachusetts, Springfield, Massachusetts is actually considered to be the dubious distinction of being the asthma capital of the nation, according to the Allergy and Asthma Foundation's annual reports and assessments. And unfortunately, it's because there's a mixture of heavy air pollution and lack of access to meaningful and quality healthcare resources. As Dr. Gentile mentioned, this often is a problem that goes hand in hand together with a number of other conditions like housing and economic insecurity and worker justice issues, food insecurity, poor transit services, and in general, redlining that concentrates poverty and pollution and really hard living conditions in these areas that in our state, I don't know about in your states, but in our state have also become the hotspots for COVID-19 infections and burdens. So it's impossible to come to this issue and not be looking for integrated solutions. So that's a lot of what we do together in Massachusetts. We look for ways to really face the root causes of all these problems, and look for ways that we can reduce the burdens. And some of the ways we've done that has been for calling for investments in clean new transit for the most underserved communities, the ones that have real traffic hotspots that leads to a lot of vehicle exhaust and tailpipe pollution in neighborhoods. We've also worked together for environmental justice reforms, looking at cumulative impacts, making sure that if there's a new polluting facility that's going to get cited, and it's a terrible pattern in this country and really worldwide, that low income and communities of color are often the first place that industry and corporate polluters will look to for citing these facilities. So we've been working hard and inspired so much by our national precedent-setting leaders in the great state of New Jersey to make sure that cumulative impacts are assessed and the communities with the greatest burdens are protected from further pollution. We've also done a lot to focus on energy efficiency and making sure that everybody in the state gets access to energy efficiency, because the more energy efficiency we invest in, the less air pollution there is from old coal and oil and gas plants, so the cleaner our air is. And at the same time, again, looking at these integrated solutions, the cheaper our energy bills are and the more comfortable our homes are, so that we can actually afford to turn the heat on and not waste it in drafty, unweatherized buildings. So that's a lot of what we've been doing and how we got involved. It's the 4th year. It's very exciting. There's been a lot of progress, and yet there's still so much to do, So that's a little bit of our story for Massachusetts, and it's really the partnerships that we have with community justice groups and with worker groups that make these efforts so powerful, that we all come together united around this vision of healthier communities and more just communities.
Yeah, well, thank you for that, Cindy. I mean, that's a lot. I mean, and I
lot.
appreciate your leadership and all the work that you have done over the years to make sure that World Asthma Day was something that was very informative to residents, not just in Massachusetts, but also in New Jersey. So I really appreciate you for that. And that leads me right into Jesus. You know, as a community organizer in the EJ community, what asthma related concerns have come to your attention? And just kind of piggybacking on what Cindy stated, the city like yours need more tools to address your growing concerns to reduce indoor triggers of asthma, healthy home tips, or support services to the community. So introduce yourself and then kind of elaborate on those 2 questions.
Thank you, and good afternoon, everybody. My name is Jesus Alonso. I'm the current community organizer for Clean Water Action here in California. You know, we focus our efforts here in Kern County, where about 80% of California's oil is produced, and more specifically here in Kern, the greater majority of that up against our low-income communities of color, and that, you know, the communities we work with. Many of the questions that we see connected to asthma is, what can we do to protect our children from asthma attacks or developing asthma? What kind of resources are out there? Because a lot of that is not readily available for our communities, and much less in their languages. And so that's just the start. When we started working out here in Kern County, we were told, oh, they do have resources several miles, specifically in the Los Hills community where we work. It's a small community of 2,400 community members, less than a mile from one of the largest producing oil fields in all of California. when they tell us they do have resources, they were referring to a state monitor, communities east from the oil fields. And although it had some help, it couldn't tell our community members exactly what they needed to know in that moment for their community, as they were right up against the oil fields and there was no monitoring in their location. So through community organizing, community effort, and the voices of our community members, we have been able to get community-owned air monitors in the Los Angeles community. The data from that goes directly to a website readily available for our community members, and that is the kind of resources we need for our communities. Something that's in their language, readily available, something they can connect with. And a lot of our community members use our website to be able to know when's the best opportunity for their children to go out and play. Because in our areas that's a concern. Our children cannot just go out and play whenever they want. And as a father, it's extremely difficult telling my son that, oh well, today's a bad air day, we're gonna have to stay inside. And that's just some of the hardships we've been facing here. Other resources that we need, other things we've been fighting for as communities is things that we would imagine are common sense. For example, because we see some of the biggest impacts within a mile of oil and gas production to human health, we're fighting for a 2,500 foot setback, just some distance, because currently here we don't have any distance between, any buffer, any distance between our schools and oil and gas production. We have pump jacks wedged between our parks, our playgrounds, and our residential areas. And that's just some of the bare minimum things that we're asking for. And another thing is that we need, that we keep hearing from our communities, is that we need support from our elected officials. Oftentimes we've been having to go to our public meetings to fight, not to fight for more protection, but to fight against less protections. We continue to have to fight against the expansion of the oil fields, increased production in the oil fields, exemptions from monitoring, or exemptions from holding them responsible for their own chemicals, their own pollution. And so that's kind of what we're seeing here in our communities, and what we're fighting for with our community members.
Wow, thank you for sharing. I mean, that is a lot. I mean, you have the right, to have buffer zones so that you could begin to protect your community from the pollution that you're suffering from. And especially when those are directly related to poor air quality. So, man, thank you. And this is a story that we're hearing all over. And so now for our last panelist, Andrea, as you introduce yourself, I have two opening questions for you as well. Like Jesus, you're a resident who lives near a port, and our nation's ports are moving goods essentially without slowing down. Even with COVID-19, this pandemic, everything has been moving much faster, which means more warehouses, and diesel pollution continues in these adjacent, or what we call frontline neighborhoods, and the impacts to the workers and the family and community is just at an all-time high. So what strategies would you suggest in the short and long term to reduce pollution where people are most vulnerable? And then also, we are both members of Athena. How does this connect to the Athena national campaign against the Amazon. Thank you, Andrea.
Thank you, Kim, and thanks for everybody who's watching. My name is Andrea. I'm with an organization called the People's Collective for Environmental Justice. We're a community-based organization out of the Inland Empire of Southern California. We're all residents, ex-workers, or workers of the logistics industry, which is the dominant industry here in our region. We're also the residents that live right next to the arteries of the transportation chains that make it possible for everybody to have things in their stores, and also that make it possible for people to have online shopping. We are what's considered a dry port or an inland port. We're about 50 or so miles from the Los Angeles and Long Beach port here in Southern California. That's the largest port complex in the United States. That port moves about 40% of the nation's stuff, and that all of those things that are on all those ships that are full of containers come into the Port of LA and Long Beach. They get onto trucks and they go into our communities. And then they get redistributed or stored to go out, because we are going into a culture of convenience and a culture of like, if I click something, I want it the next day, it has to be stored somewhere for you to get it the next day. And those storage centers are popping up left and right in our communities. We have millions of square feet of warehousing, not only in the Inland Empire, but it's happening in other parts of California, especially the inland parts of California. And we can very much expect this to happen in all the inland communities that are close to ports, because the ports can't just store it. They need to put it somewhere to store and move quick enough. So it's definitely it's the trend in which the transportation network is going into. And I would say that we are probably the case study for what it's going to look like, and hopefully also the case study of what things should change so that we don't have the same consequences we have now. Because the consequences we have now is that 80% of those warehouses are in communities of color. And that was a study that we did of the 3,000 warehouses in this region. There are thousands and thousands of warehouses in the region, but the largest ones, 80% of those are in communities of color. 600 schools in our region are located half a mile from a warehouse. And that means that doesn't mean that, not just means that kids grow up going to a school where they have to breathe in diesel emissions, but it also means that it's dangerous to walk to and from school. It's dangerous for that driver to drive in winding roads in a residential community when it shouldn't be there, when a driver should be in an industrial area taking things to an industrial port. That's what it means. And so the question was, what strategies can we take? And so one, exactly like Jesus said, I mean, it's about organizing, right? It's about organizing our community. It's about investing in like those canvassers and phone bankers that you were talking about, Kim. Like that's the bread and butter of this work, right? And it's in my opinion, some of the toughest work, because it does take time and consistency. And we do not just learn about these things overnight. It's all about relationship building. And so that type of organizing is something that that's at the core of what we do. And so we really do support a lot of like community education models and popular education models where we can do more of that. Another strategy that we've been trying to adopt, because there's been so much development here, is to understand what's happening. And so we just worked on a community-based research report with college students in the region, and they took GIS data and they took warehouse data and they started putting all these filters, right? They started putting these filters of like, well, what's the demographics? What are the asthma emergency room visit rates? What is, how much are people making in these areas, right? And we created this great report, and that's kind of some of the more of the stuff that we want to do to really integrate our community into the solutions that they want to see in their community, right? So they become the knowledgeable ones. Another strategy, because there's so much development, is we are trying to change the paradigm about how development looks like in our communities by advocating for community benefits agreements. So community benefits agreements is a legally enforceable document between a developer and the community groups. The city does not have to be involved every single time. It's really between the community and the developer. And if a developer signs into it, hopefully with the support of the city, then if the developer does not come through on their promises for a project, the community can hold them legally accountable, right? And that's something really important because we don't have enough ways that we can say, hey, you are not living up to the promises that you gave to us. And now, because you're not living up to the promises, our health is impaired. And we see that a lot. And so it's a very new paradigm shift, at least here in inland Southern California, where we have undervalued so much of our land, undervalued so much of our labor, that we do not want to hold businesses to a higher standard and say, this is the return we want if you're bringing in projects. So anytime we bring in a warehouse project, we want this type of job requirements. We want these electrification trucks. We want this investment into our community. I'm saying that's what we're advocating for right now, not that we've gotten yet, because it is a paradigm shift. We have been for so long just undervaluing some industrial areas where communities live. And so it's taking time, but our organizing is still focused there. That's some of these short-term solutions. One of the long-term solutions that I want to talk about is like regulations. We think regulations are very important. If you're making a mess, you need to clean it up, right? And it's as simple as that. And so we are doing it in two ways. One, we have an air district here who is responsible for our air quality in the inland LA area. And for years, for decades, really, I was just passed the baton, really, of people advocating for an indirect sources rule, which means that, yes, a warehouse does not have a tailpipe, or a warehouse does not have, a gas plant out of it, but it's an indirect source. Trucks come in and out of this every single day, spewing pollution. And so we are fighting for a indirect source rule on warehousing. And actually the vote is going to be this Friday, after 4 years of working the air district to get it. And it's hard. Developers have come in hard. You guys know how politicians work, right? Like it's everything that, it could be. And what this rule will do is not cap them per se, but it's going to require warehouses to slowly electrify their warehouses by putting in solar panels, by putting in charging stations, by investing into electric trucks. And every year they have to get closer and closer to a zero emission warehouse, right? And as technology picks up, we think, perfect, what a way to capture those electric trucks into our communities that have been impacted for so long. The other one, the final way is, like, we also want to target the big players. So Kim mentioned the Athena Coalition, and the Athena Coalition is focused on addressing Amazon's monopoly in our communities, right? The way that they can dictate what their cleanup looks like, the way that they're dictating what emissions reductions look like, right? And we believe that it's really important to target these big players, especially because they set a precedent for how the rest of the industry goes. So that's some of the work that we're doing there.
Thank you. And I applaud you for all that work that you're doing, because it's definitely needed. You live in a community that is the back end of the largest port, Newark, New Jersey. We have the third largest port, second to the two in California. And so I experience 25,000 trucks that come in and out of our port on a daily basis. 4,500 of those trucks stand on our local roads, spewing diesel pollution, which is a known carcinogen. And so I want to bring Dr. Gentile back into the conversation, hearing all what was said, and especially thinking about not having buffer zones, looking at air monitors, understanding that this diesel pollution is everywhere. Like, we can't escape. All we're trying to do is just let us breathe, and we're being bombarded. How can the doctors like yourself help community members and families? Like, what are some of the things, and has there been projects that you worked on where there has been community participatory with doctors and things of that nature to address these issues? Because I think some folks don't really understand that health connection with the pollution impacts and asthma. Dr. Gentile?
Yeah, I think you're absolutely right there. I have a colleague that really stresses that when you're talking to a patient in the office, you really need to know what their zip code is. And the reason for that is it will tell you what they're living beside and what their pollution sources are. We spend a lot of time asking patients if they smoke, if they exercise, what do you eat? We spend no time at all talking to them about what they're breathing. And that's something that impacts not only asthma, but all types of other diseases. Other lung diseases, heart disease. premature infants, premature death, all types of problems. So that's one of the things that we need to do. We need to educate people. It's amazing to me. Every fall, I'll have families tell me their child had an asthma attack at the bonfire. It's like, you shouldn't be at a bonfire. They just lose common sense sometimes. They don't make the connection. And that's really what our job is. We really shouldn't be writing scripts to, control this disease. We need to teach them how to prevent being exposed to these problems that cause the disease and cause the exacerbations. And that's really educating them about what is in their local area and what can they do. Again, we've talked a bit about having, monitors and trying to alert patients on, high pollution days. And it's a shame. It's an awful shame that kids can't go out and play when they want to. That's just an awful thing. But right now, that's what we have to do. We have to educate people to, really be paying attention to this, plan their day. If there are initiatives to improve housing, we need to make sure these houses are airtight and have good filtration. And we also have to teach these residents how to, advocate for themselves. I really, just consider myself as a resource. I study what the problem is, and I'm there to, tell them my findings and give them what information they need. But they need to understand what the story is, and then they have to, mobilize and really, go after and try to change some of these things. And it's a lot of work. It really is. And it's a sad state of affairs. If you look, how all of our situations are similar. Here in Pittsburgh, they were pursuing an Amazon headquarters, and they were going to give them money to come here. And then you're talking about these industries doing harm, and we're bending over backwards, giving them things to come in and harm us. There's not enough discussion of the balance of this. I don't think any amount of pollution or any amount of jobs is worth someone's life. And there are studies that show that chronic exposure to air pollution decreases your life expectancy. And, we're talking mostly about asthma today, and we still see people die of asthma. And that's awful. It's awful someone can't go out and play. We really need to focus on keeping people healthy and productive throughout their lives.
Right, I totally agree with that. Clean Water Action of New Jersey, we have been working on a campaign, zero emission zones and kids clean air zones, because we want to make sure that where our kids recreate, our parks, we should have, clean air zones where trucks can't travel down these streets, right? Or emitting facilities can't be sited on the same block where children are playing, because as they're playing, their lungs are open to the largest capacity. So if you have 100 trucks traveling down a road in 1 hour next to a park, you are endangering the lives of those youth and the families. And so there is such a disconnect between the importance of our health and the air that is actually happening in these polluted communities. And so one of the things I want to elaborate, and I don't see any questions yet, so I'll continue the conversation, but Cindy, also just listening to what has been said, and Andrea mentioned a community benefits agreement. You heard Alonzo talk about some of the monitoring. What are some additional things that you're doing in Massachusetts? Especially, I can't believe I heard that Massachusetts was the #1 place for
Springfield, Massachusetts, this particular community, it's a terrible air pollution problem, and combined with poverty and lack of meaningful access for too many to health resources. And as as many of us have said tonight, those factors can combine with a lot of other community injustices to make it a life and death issue for people who have respiratory problems, particularly kids and the most vulnerable among us. I think this is just such a powerful and personal issue for all of us, because I bet if we asked everyone here tonight, both panelists and folks, folks watching this on Zoom or on Facebook Live, everyone would say they know someone with asthma. It is at epidemic proportions, and it doesn't have to be that way. It's one of the worst feelings that I've ever experienced, watching someone have an asthma attack, someone I care about, and see them struggling to breathe, and you're powerless. You just feel like, there's not enough you can do to help. And, let alone if you're that person struggling to breathe and, potentially facing a really serious health issue. So it's a really powerful issue, and it has led to some, I think, important work moving forward at the community level. One of the big things that we've been focusing on is environmental justice reform to our state laws in Massachusetts that means now that before any additional facility can be cited, along the lines of what Jesus has been talking about, and Andrea as well, like looking at warehouses and things like trash incinerators or landfills where there's a lot of diesel truck traffic. There has to be in the siting process an assessment of what those additional pollution burdens would be, and looking at the existing air pollution in particular. There's a lot about air pollution, but it also looks at toxic chemicals and water pollution as well. But what people need in these really vulnerable communities, in the frontline communities and hotspots, to better protect our air and to really work on dialing down. We need to have an assessment of what the pollution burdens are, and we need commitments from our officials along the lines of what Jesus was talking about, that commit the political will to reduce pollution from these sources, because we know where the emissions are coming from. These aren't mysteries. It's very clear. We track, our environmental agencies track a lot of the emissions from these facilities, and we have to move forward with real political leadership to commit to make these reductions and to commit to protect, especially the most overburdened and vulnerable among us. Part of what we've been doing in the really hard hit communities has been pressing for Hepa filters in schools and in houses that are closest to the pollution sources. It's a Band-Aid. It's not, the complete solution, but it will help reduce the indoor air pollution burden that comes from, highly polluted communities. Kids need to be in healthy schools, and we know that air pollution can travel from the outside to our indoor environments, and we know that happens. So, one very small short-term measure is, we've been working for Hepa filters. It's true next to the airport as well. I live very near Logan Airport in Massachusetts, and there's a lot of concern about the emissions from the airport. Other things that we've been focused on has been, I heard Andrea and Kim mention electrification. That is another really big solution that is on the table that we're pressing for. It's a transformation of our carbon-based economy, of our fossil fuel-based economy. But if we can get trucks and buses and public transit and individual vehicles off of fossil fuels, that means that we address these, local pollutants that harm our lungs. The tailpipes are pretty much at lung level, so we need to really press for those kinds of solutions, and we need to do it in ways that respect workers who have these jobs. Make sure that there are just transition packages if there are any displaced workers in these transitions, and we need to make sure that that low income and moderate income families have the support to make the transition, because we're going in this direction. We know it's coming, and we need to be thoughtful so that this transition doesn't harm the most vulnerable among us. It's one of the first and I think most important principles of environmental justice, that the people who have borne the burden, the primary burden of fossil fuel pollution, need to be first in line for the benefits of a cleaner economy. So that's one of the things, some of the package of things that we're fighting for in Massachusetts, and hoping that we're all successful as we move forward together, because this is a lot about unity and raising our voices together, because our kids deserve clean air.
Yes, thank you for that. That is crucial. Our children, as the parents, we have to be their voice, right? So that we can get the changes that we know we need in our communities to protect them, right? And one of the things that I kind of want to ask you, Jesus, and listening to what Andrea mentioned about a community benefits agreement, and understanding that the politicians in your community are not even supportive of your community. Have you had any conversations about that with any elected officials, or where are you in terms of your strategy and how you need to address these environmental injustices that you are suffering from? Because maybe Andrea and I and the rest of the panelists can kind of help you in that.
Thank you. I really appreciate that. With our conversations with local elected officials, just off the top of my head, the fight there is just to get them to believe the experiences of the community members. That alone would be valuable, to be able to listen to us and stop the efforts of expanding production in the oil fields. What we hear a lot from elected officials is if we stop producing, if we put more restrictions, then we're going to lose jobs, which is the talking point of the oil industry every single time. You want to put a 2,500 foot setback, they cry we're going to lose jobs. 300 foot setbacks, we're going to lose jobs. We want oil away from our kids, we're going to lose jobs. And that continues to win with our elected officials. What we need to, what I would like to see is for our elected officials to put, if the concern is jobs, then to put the same effort or more effort in just transition. For those that would be losing their jobs, would be able to apply those skills to renewable energy jobs, which we're fast approaching. And if we don't make our effort into that transition, if we decide to continue to drag our feet and stay with oil and gas, then our communities are going to be left behind, and those opportunities are going to go elsewhere.
Yeah, I agree with that. And, and thinking about that, this work that we do, that's a false narrative that in order to have a clean environment, a healthy community, we have to pit our health against, jobs or workers. No, we're not against the development, but what we want is clean development, right? What we want is mitigation of those entities and establishments and businesses that are harming us, right? We're not saying we don't want certain things and we don't want the jobs, but we want good jobs, right? We want clean air and we want good jobs, and we want an environment that is thriving and healthy for our families. So I'm going to kind of connect this to you, Andrea, just in terms of all the conversation that we've been having, and thinking about the jobs, the lack of political will with the industry. I know we have been looking at a way of mapping warehouses, facilities in our communities that directly connected with asthma and poor health. And can you talk about some of those strategies? And then also, when you think about this, black carbon is a main contributor to climate change. And, you know, our summers are getting hotter, our winters are getting colder. And climate change is also directly linked to our air quality, and black carbon is a main contributor to greenhouse gases. You want to elaborate a little bit on that and how that's all connected, Andrea?
Yeah, so I mentioned it in the last question. We put together a report along with students at the University of Redlands and some other community researchers on warehouse locations and the different ways that they impact us. And we not only the students, but also other community researchers in our community have been putting in the work on trying to figure out, well, how is asthma emergency room visits? How does that compare to these warehouse locations, right? Because we know that there were studies that have been done in the region that showed like 40% of the children at a high school right next to the rail yard have asthma, right? That's almost half. And even more of the percentage of the parents didn't even know that their kids had asthma, right? And so, but the rail yards have been there for a really long time, and those have been really hard to clean up. And thankfully, a lot of research has been done about the impacts of it. With warehousing, it's a little bit new. Like I said, warehouse, we've always had warehousing, but with e-commerce, I mean, the boom has really happened in the last 5 to 10 years. So how do we track that? And so we, given warehouses and then just the other types of air pollution contributions in the region, you know, we did see that census tracts with warehouses have 40% higher rates of asthma than the rest of the country, right? I mean, the rest of the state. And that also we looked specifically at Amazon because Amazon's the largest employer here, and they have about 15 warehouses in our region alone, fulfillment centers. But then they also use other warehouse locations that aren't marked Amazon to move their stuff. I mean, they're the largest employer here. And so we saw that in concentrations where Amazon was specifically, in those regions, on those census tracts, you would see that it was like 45%, 70%, 80% in the 80th percentile of asthma emergency room visits compared to the average, right? I mean, this is pretty huge, and it's like some new like community science that we're doing, and we still need to spend more time on it. We need investments in there, but there is a very clear worry there and connection that we're trying to figure more about, because if these are directly linked, I mean, this should hopefully tell policy the way that it should move, right? I mean, this should invoke, similar to what Jesus said, right? Like, we know that there's an impact, maybe the siting needs to change, right? Then on the piece about, you were saying about Amazon and then some of those other, you know, regulators, yeah, we are hoping to, you know, Amazon, because of their work in, you know, combating climate change through initiatives such as the Climate Pledge, you know, that not just them, but a lot of businesses are saying the way that they're going to clean up, and we got to call it what it is. It's greenwashing, and we see it in the oil industry, we see it in the gas industry, and we're seeing it even in our goods movement industry, right? Like, this is just clear greenwashing, has a pretty face. What is it called? Like, put lipstick on a pig, it's still a pig, right? Like, it, you know, and that's what it is, right? And it's problematic because, you know, that millions of dollars get put into these campaigns of just rewriting history and rewriting what they're doing. And so that's why we think community research is so important, because it's kind of confronts that and says, no, actually, look at what you're doing. Like, look at what's happening. And this is really important, because we can't like fight for climate change if your operations are still hurting people. Like, climate change and those solutions really have to come from the communities themselves. I think this is a clear sign on why offsets and other types of carbon trading can be really problematic, because of the way that it can be used for greenwashing, right? And we're seeing that here. So until we see companies like Amazon clean up the communities that they're in, right, clean up the mess that they're in, they shouldn't really be speaking on the ways that they're doing so much work on climate change. Because actually, as the United States is like lowering its carbon footprint, some businesses are actually raising their carbon footprint every year, right? And they're not talking about that. So It is really important. And with electrification happening in our communities, I mean, we're setting up an infrastructure that is hopefully going to be more sustainable. But at the same time, with so much growth, if we don't figure out a sustainable way of moving things, right, and we just build out, we're still running into this issue of extraction. So things to all think about, right?
Yeah. Kim, I just wanted to make one quick comment. We're going to go full circle here. We started with asthma and pollution and then climate change, and we're going back to asthma. It's very well documented that climate change is happening, and many cities are already starting to experience effects. We're actually seeing longer pollen seasons. They start earlier, last longer. Every year we're seeing higher peaks in the pollen levels. Allergies are one of the primary causes of asthma attacks in children as well as sometimes adults. So this definitely comes full circle. Not only is the acute pollution an issue, but the impact on climate change is going to impact allergies and indeed asthma.
Yeah, I mean that is so true. I mean, and that's why I say the whole phrase "let us breathe." We have been fighting for that for years, and now when you look at the Black Lives Matter protest, and you see some of the cases where individuals have been killed because of they couldn't breathe. This is the reality that we are living with, and we want to change that scenario. Our children should not, and as Cindy stated, and I mentioned early on, as a mother of 3 asthmatic children, seeing my kids go through an asthma attack and sitting there being helpless, like it's nothing that I could do. And then knowing that I've lost individuals to an asthma attack. This is one of the most silent killers that we have. In most urban communities, you hear the local politicians, the mayor, the council members, they want to talk about homicides, and the news report how many people got killed, but more people die in a year of asthma attacks in my city and my county than homicides, but you don't hear about it. You don't see the faces of individuals who are dying from asthmatic attacks. Yeah. And we have to change that narrative. We have to let people know that this is a serious chronic disease that is directly linked to the air pollution that we are suffering from unfairly in a lot of our BIPOC communities. And so I, truly want to thank each and every one of you for participating in this panel. I'm going to go around if you want to do a quick 1-minute closing remarks, and then we're going to run our video. But I thank you, as a mother of children who are asthmatic, and I was able to manage their asthma. But there's so many young parents that can't manage the asthma of their children. And so we are going to continue to talk about asthma. We're going to continue to raise the flag that, you have to let us breathe. We need clean air zones. We need to make sure we have zero emissions in our community. And so that is very, very important. So I'm going to start with Cindy and then go around and give you all a minute to kind of just close out. But I thank you all for your participation. And I thank you all for your willingness to talk about this very important issue that's impacting so many lives. Cindy?
Well, I just want to say a big thank you to everyone on this panel, because I feel like I've learned something from each of you that is really powerful. And the bottom line is I'm actually very hopeful that with committed healthcare and health professional and community wisdom and community leaders in the mix, like we have in the places where we're fighting this, I'm really hopeful that we can make progress together. It's about building our power together and looking for the solutions that will get us to higher ground, get us to the kind of communities we want to live in. I really believe in that vision. And I just want to thank everyone for being not to use a military metaphor, but being a warrior on the road to cleaner air and healthier lungs and, more just communities. So I really appreciate everything that has been shared here tonight. And I look forward to working together tomorrow and going forward.
Thank you. Jesus?
Yeah, I just wanted to say thank you. Thank you all for all the incredible work you all do. Like Cindy said, I learned a lot from being able to share this table with all of you. It's always good to see that we're not alone in the effort that we're doing, that we're not alone in our struggles, in our fights. And so this is this was really revitalizing. It's a good feeling to know that we have a team effort, a combined effort to help our communities be able to breathe again. And so I really appreciate being able to share this time with all of you. Thank you.
Thank you. Andrea?
Yeah, I mean, likewise, this was really amazing. And it was so, this problem is so national, right? And international. And so it's always nice to just be able to bounce ideas off and also just have a place where people are thinking the same way and have the same vision for the world. Super appreciative of that. And also that this work is incredibly personal. And it's nice to be around people that see the humanity in the work that we're doing.
Dr. Gentile?
Yeah, thank you all for your passion and your commitment to this. I am very inspired by hearing the others' stories of their work. It's amazing for me to see that these things can move forward. I think we have to remain hopeful. We don't want to see anyone have asthma. We don't want to see anyone die of air pollution. And we really do need to keep, elevating the environmental justice issue of this and working together to solve this problem. So I was very inspired by all the work you're doing.
Okay, thank you all. We are going to close out with a video from the New Jersey Office of Clean Water Action that just shows some of the work that we've done. Thank you all. Thank you. I think that was the last slide. Thank you all and have a great evening. And until we meet again. Bye-bye.
Everyone.
Thank you, Kim, master moderator.
All right, Andrea. Talk to you later.
Hi, Jesus. Nice to meet you.
Likewise. See you, everyone. Take care.
Okay.